be nurse. We can, what? 1, 2, hang on. 5, 6, 7. All right, we're good. All right, we'll call this meeting to order. Are we good to go? Okay. Board of Health.
Before you start,
Mhm.
remember, Madam President, do you have your microphone on?
Oh. Yeah, it was on. You can't hear me?
It was just kind of soft. That's why I don't know if it's you or me.
Say what? I'm gonna have to get a booster chair. Oh, I didn't realize it moved. All right, how's that? Is that better? Okay. So, first item on our agenda, is there any public comment? Amy? There's no public comment. Do I hear a motion to approve the minutes from our, oh, roll call. Amy?
Allen Ginsberg, Andrew Held, Carla Pohl,
Present?
Corey Tello,
President?
Hannah Eisner, Judy Buchanan,
Here.
Richard Janetti,
Here.
Robert Kohlhase,
Here.
Scott Hume,
He's here.
I saw him drop off. He was on, then he dropped off.
Sonia Reese,
Yeah, she's not attending.
Susan Schaefer.
Susan?
Yes, here.
So we have 6, even possibly 7 with Scott.
That's quorum, right? Okay, that's what I thought. All right. Do I hear a motion to approve the minutes from our regular session on April 14th? Susan, second Bob. Any discussion? Amy, call the roll.
Carla Pohl,
Yes.
Corey Tello,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Kohlhase,
Yes.
Scott Hume, in case he pops back, Susan Schaefer.
Yes.
Minutes approved. Our next item on the agenda is the consent agenda. It's in your packet. Do I hear a motion?
I move we approve the agenda.
Thank you, Corey. Judy, second. Any questions or discussion? Amy?
Carla Pohl,
Yes.
Corey Tello,
Yes.
Judy Buchanan, Richard Janetti,
Yes.
Robert Kohlhase,
Yes.
Susan Schaefer.
Yes.
Motion carries. We have 2 presenters this evening. The first presenter is Michelle Maurer. She's from ISU, and she did some contact tracing, and that'll be followed by Kyle Hupta, thank you very much, who is the contact tracing program coordinator. So Michelle, you have the floor.
Thank you. Yeah, thank you. I'm here to thank the county for the partnership with Illinois State University. Through a lot of leadership and collaboration, the civic engagement led to a campus-wide effort that stopped spread of COVID-19 at Illinois State University. Um, this partnership steered an effort to undertake contact tracing and case investigation on campus, and it served the Redbird community and the county at large and slowed the spread. The university recently was acknowledged, and um, along with the health department, for the efforts that they made and received the Interdisciplinary Civic Engagement Award at Illinois State University. Um, since August, the center has provided service to our community. We've worked a total of 3,593 cases. Um, and with that, I think it's important to note that among those cases, 1,122 were in the dormitories alone. Uh, with that in mind, I think it was very important that this work went forward, and I think it served our county very well. Uh, the contact tracing center for the students, most of them young adults, whom I would probably refer to still as adolescents. Among them, we definitely found a lot of children, adults, young adults, adolescents who were facing fears and had a lot of anxiety surrounding the disease. Some of them experiencing loneliness and isolation, and among them, of course, some anger and some resentment, and some resistance to being grounded, so to speak. But I think that the patience and the perseverance that most of the contact tracers from McLean County and the students and workers that we had at the center provided some comfort to those students and some guidance. And I think importantly, things were handled very well. Total number of cases that we worked was 3,593. Like I said, um, McLean County workers, whom we referred to as the Fabulous Five, worked around 3,280, and we worked a similar number of hours if you include the coordinators' hours that were given. Um, just want to thank the county for the partnership and look forward to a continued partnership to keep those numbers low and serve our students. Have any questions for me?
Michelle, thank you so much for what you did. I think it really helped us try to, contain some of the spread.
Some of the spread, yep.
And before I call on you, Kyle, I just want to introduce Dr. Newbrander is also in the room um, from the Mennonite College of Nursing. You want to say anything? Okay. All right. Yes, ma'am. Susan.
I just want to say that I think that this is just another um, opportunity to showcase the coordination and collaboration that this community has with many of our partners in the county to improve the lives of all residents. So I just want to thank everyone that's been involved in that.
It was a lot of work. Okay, Kyle. Go
Good
ahead.
evening, everybody. I'm one of those adolescents that Michelle talked about earlier, and I'm going to be presenting on the contact tracing program as a whole. So I'm going to give you a brief history and then let you understand kind of what goes on the day to day. I became a part of this effort because I was one of the first people in this county diagnosed with COVID-19. When we started this program, it had roughly 6 people. We had limited training material, no back-end management, a new CRM, and we're scattered throughout MCHD. And as many have said before, we kind of built the plane while flying it. After the previous director's departure, I took over as the contact tracing coordinator, mostly through Tammy's aggressive negotiation. At its peak, this program employed over 55 people. working multiple functions, including but not limited to field tracing, back-end management, auditing, ISU special assignments, management of K through 12 schools and preschools, and the monitoring of all outbreaks. This was all while continuing their duties as contact tracers and or case investigators. So what is case investigation? It entails a confirmed case being contacted by a CI once their file becomes available in Salesforce. The case investigator must collect basic information like race, gender, ethnicity, and the date of birth. They go through the case's health history, check for current symptoms, underlying health conditions, and discuss risk factors and emergency warning signs. They then determine the isolation period and advise on best practices for limiting the spread. Finally, they brief the client on resources and make requests for whatever they may need during their isolation to keep them safe. The case investigator will then finally move onto locations like where the case lives, works, or has visited during their infectious period, and this helps gather the names and contact information of close contacts, which we then enter into Salesforce. The process for a close contact is pretty much the same. It entails the same questions about basic information and symptoms, but the contact tracer determines how long the contact should be in quarantine based off of their last exposure to the case. Now, while close contacts don't have the list of names generated that a case does, there can be a struggle to get them to cooperate. A large portion of a call might involve explaining why they must quarantine, or if they don't have any symptoms, why we are asking them to stay home, or even why we can't tell them the case's name due to HIPAA. I believe calling us a contact tracing program at this point would almost be incorrect. We, in a matter of months, created a division to help maintain the health and safety of our community. All my team members have come together to create what you see now. It was not me, and I will never take full credit for it. We also have one of the most diverse staff to date at the McLean County Health Department. I want to specifically thank Tammy Brooks. Without her continued guidance, I don't believe we would be at the level of efficiency and productivity that we are today. Contact tracing is not simply contact tracing. It is case investigation, all of the additional duties I outlined above, resource guidance, call center function, call center management, vaccine scheduling for community members, guidance for individuals on COVID-19, and all the OSS duties that come with running a division. I'd like to end this with some stats, and these are not from the beginning of the program, but from the beginning of 2021. Our average wait time currently is 16 seconds. Combined contact tracing and the call center have handled over 36,000 calls. We've had a combined total roughly of 21,000 cases and contacts worked. And of those, 9,000 have been worked since March 29th, which was the beginning of our last surge. I'm happy now to answer any questions from the board, and I'm so glad this was over because I was extremely nervous.
You did a great job, Kyle. Thank you.
I rehearsed it about 6 times, so I hope so. Tammy can attest to that.
Bob, go ahead.
Great job, Kyle. We're all friendly here, so don't worry. Did we have the opportunity to have more than just English-speaking contact tracers to help in different areas?
Absolutely. So not only do we have Spanish-speaking contact tracers, but we also have a translation service that we use. So any individual speaking just about any language can be contact traced and or case investigated through that service. We do have to pay for it, but it is well worth it to keep those members of the community who don't speak fluent English safe. Anyone else?
Go ahead, Corey.
Corey?
I'm not even sure I want you to really answer this, but I'm guessing you have all totally mastered the command of dealing with challenging situations and people, and I'm sure that you all are now able to just about get anybody to cooperate with you, and I'm sure that has been sometimes very challenging. So my hat's off to you for figuring out how to make people comfortable with something that is it can be very invasive when you have to ask all the questions you have to ask. So I'm sure you've learned or added to your diplomatic skills.
Yeah, I would say my team definitely learned over time a great deal of how to communicate with the public and get them to comply by in a non-confrontational way. I have previous experience both as an officer and police dispatcher, and it reminds me so much of police dispatching. As far as learning goes, though, and structured environments, Tammy has taught me so much about working within government, working within administrative capacity. So this job has been a blessing for me. It got me out of poverty during COVID, and I have nothing but respect for all of the leaders at the health department.
Thank you for all of your work and also your leadership to others who also did a fabulous job.
Thank you, ma'am.
Anyone else have questions or concerns? Well, Kyle, I think all the board feels the same way, that thank you so much for you and your team and Tammy. You guys have done an excellent job. It contact tracing is incredibly difficult to do, having done it myself. Not everybody is pleasant to talk with you, and they certainly don't appreciate being told they have to stay in their house for 10 days. So we appreciate what you did. Thank you for coming here tonight. Just tell them, if you could tell your team from the Board of Health, how much we really appreciate all the work that you did. And we really appreciate it, but we hope that we don't need it too much longer in the future.
I can guarantee you that they're all currently watching this meeting.
Well, thank you guys. Okay. We'll move on in our agenda to committee reports, behavioral health. Does anyone have a report from Sonia? Okay. Mental Health Advisory Board.
CHCC hasn't met.
Oh, that's
They
right.
don't meet again until
Remind me again, Susan. Do you remember when they meet again?
they don't meet until June.
June. Okay, thanks. All right, Mental Health Advisory Board.
Our next meeting is May 20th. But if it's okay, I'll go ahead and give the report on the Behavioral Health Policy and Funding Committee, because I chaired that in Hannah's absence. And I just, first of all, in your packet, you saw the schedule the timeline we have for the funding cycle. And I'm so glad we're beginning early in our beginning conversations about that through our policy and funding group, which obviously we always bring back to the full board. We did decide, and you have it in your packet, the 4 broad focus areas that we believe, all the applications RFP should fall under. And again, that's crisis response, youth services, adult services, and specialty courts. Again, those are very, very broad, but they kind of create a full continuum of everything from prevention, early intervention, all the way through more intensive interventions. And at our meeting, we spent time talking about knowing that those are the 4 areas that we feel very much are core focus services, and knowing that the services that we've funded in the past several years make up those core services, and some of them we know we will fund again because they are just that critical to the behavioral health infrastructure here in the county. And so we are looking at a possibility of doing some renewal applications for people for agencies, entities that we will fund again, and not make them fill out a totally complete new application. So we're looking into that and that will certainly come before you when we get to that part. We also are trying very hard to think about, there has been so much unique funding coming into the city, county, state, and federal from all of those places because of COVID dollars, American Recovery Act, the many funds that are coming to support the reopening of our country. And so we want to be mindful of that kind of funding as we think about how we want to spend our $553 to make sure we're, getting the maximum benefit from our $553 and, um, realizing that if some entities may be getting fairly generous dollars from other entities, we want to factor that into the equation. We also, though, are mindful that those dollars will go away at some point, and so we need to really think about sustainability. So we want to really think about what we do the next couple of years, because dollars, for example, coming in for rent and homeless services are pretty solid right now, but they will go away at the end of 2023. And so we have to be mindful of what we need to have in place for 2024. Um, so we want to really think about collaboration and coordination, as Susan mentioned earlier. So, and we want to keep assessing needs, because we also don't know yet exactly what all the gaps may be that show up after, we get into transition, the bridging phases that we're talking about. Um, we also are, mindful of the adult psychiatric program that we did not fund um, in the full amount that was asked for last year, and want to continue to monitor. Are there some clients then that, how are clients that cannot be served because of less than dollars? How are they being served in an alternate fashion, and how can we help shore that up, the alternate supports for those people? And again, as I mentioned, finally, we're going to consider amending our RFP forms and processes to talk about renewal applications. So, and also with an eye to knowing that there may well be very worthy um, services that will be brought to our attention that we have not funded but are very worthy. And so, we also looked at a couple of our members. I believe that Hannah, our chair, and Judy Buchanan are going to have, are going to be meeting with county personnel, Camille Rodriguez, and our own Jessica, and others, to see if there's a way to think about how are we looking at all the funding that might be available for behavioral health services. So after droning on, I'll see if you have any questions.
Okay, county board, Susan?
Uh, Health committee was pretty quick, I think, this last month, and things are, fewer questions, a little bit of praise for the health department with finally getting some of this vaccine out, and the increase in vaccines, and so it was pretty uneventful.
Any questions? Yeah, good. Any questions? All right. We'll move on to our Health Department Administrator's Report. And that's in your packet on pages 3 through 18. There's some great information and excellent graphs in there. Does anyone have any questions or comments, anything they want to talk about? Go ahead. Jessica has something she wants to say.
So it's not in my packet because it happened after the packet was really being put together. But this Friday, the state is slated to move to the bridge phase. So the bridge to phase 5, and a decision really driven by data, showing that we're meeting the metrics to make that gradual one step closer move to the new normal. And I really think it's a testament to the mitigations that we've had in place for the last year: masks, social distancing, limiting gatherings, and now, of course, the vaccine. So, but we can't ignore that individuals are still getting COVID-19. They're still getting very sick, some needing to be hospitalized, and tragically, we are still losing our friends, family, and neighbors to this virus. We have confidence in the effectiveness of the vaccine in preventing hospitalization and death, um, as it's proving to do, but no vaccine is 100% effective. So just wanting to caution the public and just continue to say it that the bridge phase does not mean this pandemic is over or this virus is done with us. We're going to continue to promote social distancing, masking, and we're looking to the public to help us continue following the guidance and, get to that new normal.
Thank you, Jessica. Judy, did you have, go ahead.
Just a quick question for Tom. I was curious, I noticed in your report, Tom, that septic systems evaluations looked like they were really increasing. I was curious as to why, I interpreted it correctly, why is that happening?
Go ahead, Tom.
I'm sorry, Ms. Buchanan, your question broke up at the last part there. Could you repeat the last part of your question?
And I just have a curiosity about the septic system evaluations. I believe I noticed that a substantial increase. And if I'm reading that correctly, I was interested in why.
So generally, that last time we saw an increase like that, a major employer within the community was making some changes in their corporate structure. A lot of houses went for sale, and we're seeing the same thing occur. It's a combination of basically people moving out of the community or moving elsewhere in the state or in the community, out of areas the rural areas that have septic systems. That's generally what that indicates on that increase. People are moving.
Thank you.
Thank you, Tom. Anyone else
You're
have
welcome.
some questions, comments? Susan, go ahead.
I guess this is a question clarifying some things. When we look at the IDPH website and we see the percentage of the state that's been vaccinated and then the percentage of the different counties that have been vaccinated or fully vaccinated or whatever. And I'm not sure if we can or how we could do that when we convey to the public that our population in McLean County, our age group is much lower than other counties. So that way, when you know, and it's lower than maybe the state average. So you had a lot of people that were older in other areas where we had a lot of people that are younger that weren't eligible or even today still aren't. Well, maybe by the end of the week or end of the day might be eligible. So I think that that might be helpful to somehow convey to the public on things like that, that we have been vaccinating people and people are, I mean, if you look at how many people that are 65 and older have been, the percentage in our county have been vaccinated. I think that might be useful because sometimes you can take those numbers and make them look good or bad depending upon how you look at them. So I don't know if that's possible, but might be beneficial to the public to understand that better.
Yeah, this is Dr. Genetti. Can you hear me okay?
Yes, go ahead, Dr. Giannetti.
Yeah, so about the last point, I think what slowed our uptake was the amount of vaccine we were getting from the state, which the state determined initially. And I think there's plenty of opportunity now for patients to get vaccines at multiple venues, and we've got spots going, basically unutilized time. So that really feeds into my question: is that what are we going to do to try to close that gap? I've been very encouraged over the last week. Our numbers are going down. I've been very encouraged, but we still have some people resisting to getting the vaccines, and we're not going to get totally through this unless we close this gap a little bit more. So, do we have any plans as a health department to try to close this gap or get to the public a little better? Or what are our thoughts on that?
So, talked a little bit about it in my report, but really focusing on convenience. The kind of wait and see. If it's there, I'll get it. So, doing walk-ins, we've started doing those now for a couple weeks, and not having too many yet, but hoping that the more that we promote it, it will start to pick up. Um, we've been looking at some public events that might be going on this summer, and again, with looking at convenience, um, just being there and offering the vaccine to people who may not have gotten it if it wasn't basically almost brought to them. Um, then obviously knowing that the last probably 20% of our population were going to be the most difficult. So just continuing to talk about the safety of this and what it is doing. Just like you mentioned that we're starting to see our cases go down, and how we can get through this if we all get vaccinated. So I wish I had a very, very good this will work plan, but it's going to be very multifaceted, lots of public awareness, um, working on some media, working on know, social media campaigns, but again, convenience has been one of the things that we're looking at. How do we make this very, very easy for our public to get? And talked a little bit about also working with our schools and other community partners to make it available at the schools, and the universities. We've been working with them to also get those college age students, which not all of them will show up in our county demographics as McLean County residents, but they're getting vaccinated before they go home, which is wonderful, and they'll be fully vaccinated when they come back in the fall.
Corey, go ahead.
Um, Jessica, do you have any sense of any groups that, with certain demographic groups that we could help um, target for marketing? Or, I mean, I know you're marketing, I'm sure you're trying to, through your marketing, hit anybody and everybody and have it be that broad. But I mean, are there any special subgroups that we know that are more hesitant right now that we could um, help do something, more targeted for, that you can think of?
Yeah, we've done some public service announcements. IDPH and other studies have shown that um, older white male Republicans have been the highest level of hesitancy. So we've done some public service announcements to really try to target that group.
And are we using local people? We're using people that are in that demographic that those people would have some respect for, or have some knowledge of? That's how you're doing that?
Yes.
Susan, did you want to say something? And I'll get to you, Judy.
Okay.
Yeah, my question was, when you mentioned in your report about updated flyers for food establishments when going out and doing food inspections to promote the walk-ins, are these in just English, or are they going to be in different languages? Because I know we have definitely multiple languages that are spoken in some of these restaurants that are that we have. I know, like, we have a large Indian population, and I don't know if there's things like that, or the in Spanish or even French for some of the other populations that would be possibly working in the restaurants. A lot of times they're in the back, but I just was kind of curious if they're going to be in multiple languages.
Marianne, were you going to address that?
Yes, I can address that. We have put that out to be administered in Spanish. We have not done French or Indian, but we have done it in Spanish, and we've made it available online as well with clickable links. And also, we have scannable QR codes on those as well. And then when those, you can take your cell phone and just like you're taking a picture and you can scan it, it'll take you directly to the site where it not only will give you the option of being able to choose your clinic, but it also brings you to our vaccine vax town hall in both English and Spanish, and it also brings you to a tutorial to show people how they can register online in case they're having difficulty or have questions, and lets them know that we do have available in other languages, particularly in Spanish, people who will be there at the vaccine clinics to not only help them with the intake and to get registered, but also speaking to vaccine nurses all the way through the process. So we've really done our best to try to make that available, particularly in Spanish.
Judy, go ahead.
Oh, okay. Yeah, thank you. And Jessica, thank you for, and I noticed in your report all, as you said, the multi-levels that you're approaching. And I'm aware that you've done the drive up. And of course, we went out to at least one of the churches in the community. In your plans, in addition to using social media and other media and platforms, do you have plans to actually go to certain places in our community to provide clinics or to provide the availability of that clinic?
So, I guess I want to speak a little bit to the many partners that we have on board in this effort. So, we've been providing vaccine to, I think, about 7 different partners in the community. So it's really been a collaboration and a community effort to get the population vaccinated. So if we're not necessarily going, we've been really focused on mass vaccination. If we're not going into, say an employer or a certain agency, then we're working with these partners that we have on board to see if they're able to go out. So at the moment, we don't necessarily have any plans to go to maybe an employer or another business. But we're working with those partners. Same thing with the school. So working with the local pharmacies, local healthcare providers to help us fill those gaps. So if we're the mass vaccination sites, then they can help us in these other ways. So I hope that answers your question. We've been working with just a few agencies to have closed pods. Um, uptake has not been as high as we would think. So we've been again focusing mainly on mass vaccination sites and using our partners to really, we couldn't do it without them. So to help us fill in those gaps.
No, thank you. That is helpful because my question was really how much are we getting out into the community? And at this point, we have 7 partners that we're working with. Are we going on site to those various partners to do clinics?
So those partners are, local healthcare providers, pharmacies, and so we've been allocating vaccine to them so that they can go out and either offer the vaccine through their offices or again hold clinics at an employer's a business. So using again this community wide approach rather than just the health department taking it on. It would be a lot for us to take on. So we could not have done it without all of the different partners also helping out. And we've got our mass vaccination sites and they run a lot through, but all these other sites are very beneficial and important to us as well.
Oh, I applaud you for that. And I think maybe an example of that, I read in the newspaper today that Unit 5 was working with Advocate Broman to try to accomplish that. And I know Broman's been a very active partner. So I applaud that effort and just hope we can keep it up.
Yes, again, wonderful partners just saying, what do you need us to do? And being able to have that public health lens and say, this is what the community needs. Can you help us? So that's really been the behind the scenes mass vaccination effort, I think, that gets lost a lot in our large sites is that it's been a lot of coordinating of efforts that we don't end up actually doing, but still watching what is needed in the community and then the community partners helping out.
Right. And I think that might even go to, and I can't speak for Susan, but we're talking about the community's perception of what we're doing, how well we're doing it, are we doing enough? If there is some way, and I'm looking at Mary Ann there, that we might continue to really promote that, or at least get that information out there, that all these activities that are happening are not just happening there because of a strong partnership and leadership of the health department. That might help the public perception that we are really more at the center of this than some, I think, feel is the case.
I agree, and we do work on that messaging every week, particularly when we talk about our when we have our weekly Friday press conference. You know, we do try to go down and talk about some of the go down the list of some of the more remote clinics and where we're at and who we're working with. And just last week we were talking about working with the school districts. We anticipate more questions about that. You know, since the CDC and FDA announcements today about Pfizer for 12 and 15-year-olds. So we're working on that messaging and trying to reinforce that every single week.
Well, we'll deputize all of us to help with that. So
Sounds good.
a little badge,
Corey, go ahead.
Jessica.
I know that Chestnut Family Health Center, they are giving the vaccine. Is the Community Health Care Center in Normal, um, the Community Care Center, are they giving it as well now?
Not to my knowledge.
Bob, go ahead.
Thank you. A question that I think would be good to hear from Jessica, and then also first a comment. Two comments. One is I am continually impressed with the collaboration that many organizations look at through this pandemic of how the health department has collaborated, and it's just an example of how many things should happen in our world, and I compliment you. I also, the other comment, and then I'll get to my question, is that I am willing, and I would encourage my fellow board members to be spokesmen when asked to speak in any environment to promote the vaccination, to get people to be vaccinated. And so I'm willing and able, and when I talk to groups, when I'm with people, I always try to bring that up, and then I get a sense of some of the reticence, and you know, some of it's just a lack of understanding of the science of how the vaccine is developed and the amount of research that goes into it and testing. And some people you will never ever get past that, but I think maybe we can convince some others. And so in our messages, if we can maybe, you know, insert some ideas about, you know, the amount of testing and the science-based validation of this. My question is, can you just comment, Jessica, on the preparation for the under 16 group that is coming out with the Pfizer?
So, you know, part of it is looking at when and where we're offering the vaccine. Part of it is also, you know, looking to those partners that we're helping, and we're asked to kind of look at their 16 and 17 and 18-year-old population base to now look a little bit deeper and further back. Um, you know, we've also been looking at, we currently um, require a parent or guardian present and for all the vaccines if you're under 18. So just looking at, again, knowing that parents have to work, that might be challenging. What can we do to accommodate that? How can we, you know, we've been offering the drive-through clinic once, and we're looking to have another one next month. And I think, again, a big partnership is going to be with the schools and the you know, Carl Broman and Genoa Pharmacy that we have that um, already kind of had those connections with the schools, and so can be that resource if given vaccine, to set up clinics at the schools possibly. Someplace that's familiar, school's still in session for a little bit longer, so we can get some of those kiddos at least their first dose started. I wish there was a lot more that I could go into detail about planning, but things have moved very quickly. So our clinics the rest of this week. Pfizer is available for anyone 12 and up. So there's still appointments available and people can register for those appointments.
Susan?
Kind of a follow-up to what Bob was asking. And I think, I don't know if I read it in your report or I read it somewhere about how doctors' offices, pediatricians' offices, things like that can now register through iCare to receive the vaccine. And I know that there were some other primary care doctors that were getting it already, but how is that going to affect? Are you still going to be the one when they're going to be asking you for, they would like to have X number of doses and then you allocate it to them? Or are they going to start getting it directly from the state without even having to have you do anything at all with it? So that may lessen your load, because I could see a whole lot of doctors' offices all of a sudden, wanting to have some vaccine available, and you're being inundated with that kind of thing and trying to keep track of 50 or 60 different providers. So I'm kind of following up on that, especially with the younger ones now, and then when they even go younger, what they're looking at in September to a 2-year-old. So
Yes, it has been very complicated to track even just the few providers that we've been allocating doses to. But yeah, I don't know the exact date that it will switch over, but those providers that are iCare COVID-19 providers will be able to order their own directly from the state. So IDPH has, thank you for reminding me, a big push to pediatricians to get registered as iCare COVID-19 providers so that they can just order, have it in their office, and be ready for that.
Sorry. Sorry about that, guys. Parents in the community are going to have to be careful in terms of timing. So if they get the COVID vaccine right away, especially those who have children entering sixth grade, there's a mandatory vaccine that has to be given at sixth grade. There has to be 2 weeks on either side, but you have to have a 2-week window. So you get the COVID, you wait 2 weeks, and you get another vaccine, or you get I think it's the pneumococcal vaccine, and then you have to wait 2 weeks before you can get COVID. So if you know people out there who have young children, encourage them to get vaccinated right away. Don't wait. Don't wait till school starts and they're trying to, oh, I can take them in and get this other vaccine at the same time, because that won't work in this case.
Yes, yeah, we're working currently on finalizing some public information messaging about that specifically because it's a 7-week time frame is really so. It's very important for parents to start thinking now, planning now if their kiddos need back to school shots of when they're going to get the COVID shot or when they're going to get the shot that's required for school, and talking with school nurses just to be prepared for that of don't put it off and wait till the last minute because there is that 7-week time frame.
Any other discussion? Thank you so much. And I want to thank Tom for his report. I was kind of hoping that the COVID restaurant complaints would start going down, but that doesn't seem to be the case. So Tom, thank you and your group for the work that they're doing. And Kim, this was a great report in our packet. So thank you so much for doing for doing the day in the life of, particularly the comments about the reaching out to fathers of women who have had a miscarriage, because a lot of times I think we forget that the dads suffer when they have a miscarriage just as much as the women do. So thank you both for what you're doing.
Welcome.
Welcome.
All right, we'll move on to our action items. The first action item is approval of 4 priority areas for FY 2022. And those, as Corey has mentioned, are youth services, adult mental health, crisis, and justice. Since this is coming from a committee, I don't believe I need a motion or a second. We do? Okay.
I
Right,
so
Judy.
move that we adopt the 4 priorities as distributed.
And Susan is a second? Is that correct? Okay. Any discussion or questions? Right. Amy, call the roll.
Carla Pohl,
Yes.
Corey Tello,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Susan Schaefer.
Yes.
Thank you, Amy. Motion carries. Our next action item is approval of an extension plan for COVID-19 contact tracing call center beyond May 31st. And I believe that's on pages 21 to 23. Maybe.
I move we approve the extension plan as outlined.
Thank you, Corey. Second, Judy, thank you. Any discussion? Susan?
I'd like to ask Jessica to work with Ms. Rodriguez on the funding for this when we get to the point where you have run out of funding.
I provided the total cost to keep all 39 to 40 of the current tracers on board through November, because that was requested at the last board meeting. That's not the plan or ask. The ask tonight is to approve to retain a team of 25 through August 31st. And for Ms. Brooks, the contact tracing program coordinator and I will be assessing then in July what is our needs are for after August to bring those to you in July. And so yes, we will get with Ms. Rodriguez if additional funds are needed.
Judy, go ahead.
Question, Jessica, I noticed in your report, and thank you very much for putting all this together. It's helpful. You referred to a fund balance, and it looks like it would appear that maybe we'll have to draw a little over $100,000 from our fund balance. Am I interpreting that correctly?
So we are still awaiting any information from IDPH on the request. So we've requested just shy of $180,000 to supplement what will be remaining in the contract at the end of May. So
Right.
we've requested that, and even with the requested amount and what's remaining, if we would keep all of those 25, that team of 25 past August, yes, we would need about 70,000 from fund balance still.
But then you also indicate on page 23 an additional $36,000. Is that a fund balance amount that you're anticipating drawing from?
That is an error. So ignore that little paragraph. That is an error.
Okay, so is it really, we would come out 36,000 ahead?
So yes, it's not a deficit. It's actually that we would come out $36,000 ahead,
Yeah.
that would be remaining. So at the end of August, we'd have their 36-ish thousand dollars remaining. And with that and the potential money from IDPH, we'd still be a little bit shy.
Okay, very good. Thank you. Appreciate that.
Any other discussion? Okay, Amy, you want to call the roll, please?
Carla Pohl,
Yes?
Corey Tello,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Yes.
Scott Hume,
Yes.
Susan Schaefer.
Yes.
Motion carries. Is there any other discussion this evening? Tammy?
Hello. I just wanted to express my appreciation to the board for your support in trusting us to make this plan for the continuation of the contact tracing um, unit beyond the May 31st grant deadline. These are difficult discussions to have, difficult plans to put together. It would have been much easier. Jessica and I said earlier this week, if we had a crystal ball, this would have been much easier. So with trying to be the best stewards of fund balance, as well as making sure that our community is protected and provided for, this is what we are pretty confident in, that it is going to work. We also have had additional support from other resources that's come forward through the state that we think is going to help us out a lot. But again, just getting back to knowing that we had the support of the Board of Health behind us was really helpful in navigating this process. So thank you.
Thank you.
Go Tammy.
Kyle? Oh. All right, then. No other comments? Well, then, ladies and gentlemen, thank you so much for your time, and we are adjourned.